Back pain is the set of symptoms that present discomfort centered in the spine. This problem reduces a person's functional abilities. Anyone can suffer from back pain. In fact, about 2/3 of the adult population suffers from it on occasion. The causes of back pain. Most of the triggers for low back pain are due to alterations in the structure that makes up the spine. Among other things, it can affect ligaments, muscles, spinal discs, vertebrae. Specific factors. There are specific causes, such as trauma, poor posture and muscle weakness. The damage may also be due to excessive exertion and mechanical overload, which cause pain in the back. Non-specific factors. On the other hand, back pain may not be due to any of the above causes. This is pain that varies in intensity according to changes in posture. It can also vary when performing certain physical activities. In these cases, it is necessary to analyze various biological, social, structural and even psychological elements. Risk factors. 1. Stress and depression. According to various studies, both chronic pain and lower back pain are regularly associated with states of stress, depression and anxiety. Although the cause of the pain is physical, it has been shown that psychological factors have an important impact on the development and treatment of these discomforts. For this reason, it's advisable to take a break and relax. It's necessary to maintain a good sleeping schedule and include enjoyable activities within the routine of your daily life. Learn to relax with these easy exercises to relieve stress and improve your mood too. Age. Over the years, the body is naturally worn out, including the spine and joints. For this reason, back pain is more common in older people who usually suffer from ailments such as osteoarthritis or spinal stenosis. In contrast, young people are affected by defined issues, such as the case of disc herniation or degenerative disease of the invertebral discs. 3. Genetics. There may be a genetic predisposition, especially in people who have symptoms of back pain and disc disease from a young age. According to some studies, the mutated gene carbohydrate sulfotransferase 3, CHSD3, seems to be responsible for increasing the risk of developing lumbar disc degeneration by 30%. These investigations also indicate that if one of the parents has this gene, there is a 50% probability that the child will also suffer from it. For this reason, it is best to maintain a healthy lifestyle and avoid intense physical exercise. In case of possessing said gene, weightlifting should be completely ruled out. 4. Labor risks. The World Health Organization, WHO, considers there to be a relationship between musculoskeletal disorders and physical effort during work. Activities that require great effort are those in which one carries heavy loads. This involves moving, pushing or even using machines or tools. However, back pain can also be caused by the number of repetitions and the number of hours per day that a single person is habitually exposed to such effort. While occasional stress injuries are acute but brief, exposure to habitual stress can result in chronic injuries and disorders. Some considerations that can be applied in these cases are carrying heavy loads close to the body and bending the knees to keep the back straight. Likewise, it is advisable to maintain a moderate pace when executing risky activities. 5. A sedentary lifestyle. Worldwide, physical inactivity is one of the risk factors for mortality, and obviously, it damages the state of the locomotor system. It is essential to stay active because muscles retain their functional capacity, as do tendons and bones. Otherwise, the biological structures will weaken and will not have the strength to protect the spine and give the joints and ligaments stability. In the end, a lack of muscle power will increase the risk of pain appearing or persisting. Yes, sometimes it is difficult to stay active, especially when you are in a sedentary work environment. However, taking the stairs instead of the elevator or using the car less and walking are good strategies to increase physical activity. 6. Bad posture. Bad posture is one of the most common causes of back pain when there are no injuries in the region. The reason is due to the inadequate weight distribution of the head. As a result, the muscles of the back are tensed and subjected to overexertion in order to find balance in the body. The correct posture when standing keeps the head, shoulders, hips and ankles aligned. However, if you are sitting, you should rest your feet on the floor, keep your knees at a right angle, keep your back against the chair's back and, above all, avoid slouching. Likewise, one should refrain from twisting or bending the waist as much as possible, since these movements are associated with an increased risk of back pain. Main image courtesy of copyright wikihow.com.